For more, let's bring in Jamie Lachman. He is a senior research scientist with the Department of Social Policy and Intervention at the University of Oxford in the UK. Welcome to DW. Now, children spend a lot of time away from classrooms and their friends and in front of screens, along with all the other constraints the pandemic is causing. Will all of this leave lasting scars on children's psyche?
Well, that's an excellent question, Chris. Children and families have faced unprecedented challenges during this COVID-19 pandemic. We've seen higher rates of violence, less social interaction, delayed education, lockdowns, and these really can have a lasting impact on their lives and their future development. But we also have to remember that children have an inherent resiliency and capacity to recover from adverse experiences, especially if they're given the right sort of support. And this includes helping parents provide that nurturing and loving care to them.
I want to talk about the support in just a moment. First, you mentioned challenges. Now, an estimated 1.5 million children worldwide have experienced the death of a parent, a custodial grandparent, or other relative who cared for them as a result of COVID-19. How do we tell kids best what this virus is and what it can do?
I think it's really important to try and communicate to children at their level, to really understand the developmental stages that the children are at, and to really give children the opportunity and space to communicate their concerns and fears. And there's a lot of really helpful information on websites for the UNICEF and the World Health Organization that can provide parents with guides on how to talk to their children about COVID-19, how to talk about bereavement, and how to cope with some of those difficulties. And we've been developing those resources very closely with both UNICEF, World Health Organization.
What symptoms are there by which parents can recognize my child is not well, they need help?
Well, I think the first thing we have to think about is that it's important that parents establish strong and positive relationships with their children so that they can notice if their child is needing help or extra support. Sometimes children might start acting more withdrawn or less communicative, and at other times they might be acting out or behaving in difficult ways, interfering or acting in ways that they haven't usually been acting in, like interfering with their siblings or other difficult behaviors. And I think for parents, they can really be open to the children and make a space for them to communicate to them so that the children can express and feel like the parents are someone to go to when they do need help and when they're not well.
Now, you were involved in the development of the COVID-19 parenting tips. Now, you already mentioned communicating on the child on the level of the kid is one of these tips. What other pieces of advice can you give us?
So I'd be really happy to share some of these. We developed these tips in collaboration with the UN and donors like Lego and Oak Foundation and so many volunteers who helped us translate them into over 100 languages so that they were received by almost 200 million people in 186 countries, with 33 governments putting them as part of their national COVID-19 plans. And some of the most important tips were simple ones that were around that relationship building and also reducing stress for parents in their daily lives. And so one of them was the tip to spend 5 minutes of one-on-one time with your child every day, letting your child choose the activity and following your child's lead during that activity. For teens, it could even be having a conversation and letting them choose the topic. Or for kids, it could be any sort of game or activity that they like doing. But for parents, and this is really essential, is that they need that opportunity to reduce their stress so that they're less reactive and more responsive to their children. And we help them think about how you can take a pause. Even 3 or 4 or 5 deep breaths can make a difference in how you respond to your child in a more loving and nurturing way.
And Jamie, briefly, if you would, what's next on the horizon as COVID-19 continues to impact families' lives?
Well, COVID-19 hasn't ended, and it's still really having an immense impact on people's lives all around the world. And I think that it's really important that remember that parents could always use more support, especially those living in difficult situations like crowded and violent communities, struggling with poverty or other pressures. And so we're working really closely with our partners to rapidly develop and test scalable solutions that can combine both in-person and digital approaches to support parenting. And so the next 5 years, I really think that this will take a combined effort from universities, governments, NGOs, the private sector, so that we can really make sure that millions of families are receiving evidence-based, accessible, and useful support that is meaningful to their lives.
Jamie Lachman of Oxford University, thank you for talking to us.
Thank you.
Now, amidst all these projects, we urgently need to finish. Children demanding our attention now. And of course, trying to stay healthy, we all could use a little break. So before we let you go, here's some advice from the Covid-19 Parenting Initiative. Maybe it'll help make your daily life in the pandemic a bit less stressful. Enjoy, and see you back here tomorrow.
Remember that you have a choice. Let's slow down. Take a few deep breaths. Remember all we have to be grateful for. Let's slow down. Take a few deep breaths. Because I really couldn't love you more. You can take a pause, you can count to 10.